Good morning, everyone. Today I am going to present the topic Physical Examination under Nursing Foundation. Physical examination is an important part of nursing assessment. It helps nurses to collect objective information about the patient's health condition using different examination techniques. A proper physical examination helps to identify the problems and monitor patient progress and provide appropriate nursing care. In this presentation, we will discuss about the definition, purpose, methods, and what are the equipments needed for doing a physical examination and precautions involved in physical examination. So next we move on to the definition of physical examination. So physical examination is the systematic collection of objective information through examination techniques. It involves observing, touching, tapping, and listening to the patient's body to identify normal and abnormal findings. Unlike subjective data, physical examination findings are measurable. Nurses use physical examination to understand the patient's health condition accurately and support diagnosis and treatment planning. So next we move to the purpose of physical examination. The main purpose of physical examination is to detect the diseases at an early stage and understand the patient's conditions. It also helps nurses to monitor improvement and deterioration in the patient's condition. Physical examination findings helps confirm the information collected during health history taking. Through regular examination, nurses can identify complications early and provide complete, timely interventions to improve patient outcomes. Next, methods of physical examination. So, there are four main methods of physical examination. They are inspection, palpation, percussion, and auscultation. Inspection means just we are observing the patient carefully using vision. Palpation involves examining the body by touch. Percussion means tapping the body surface to produce sounds, and auscultation involves listening to body sounds using a stethoscope. So these methods helps nurses to collect accurate information regarding the patient's health status. So inspection. So we have already discussed about inspection. Inspection is the visual examination of patient's body. During inspection, nurses observe posture, skin color, facial expression, body movement, and overall appearance. Adequate lighting is important for proper inspection. Nurses should compare both sides of the body for symmetry and identify any abnormalities. So, inspection is usually the first step during physical examination because it provides valuable information without touching the patient. So, next method is the palpation. Palpation means examining the body using the sense of touch. Nurses use palpation to detect tenderness, temperature, texture, swelling, and masses. There are two types of palpation. One is the light, another one is the deep. Light palpation is used to assess surface characteristics, and while deep palpation helps to examine internal organs and deeper structures. Nurses should perform palpation gently to avoid causing pain or discomfort for the patient. So next method is the percussion. Percussion is the technique of tapping the body surface to produce sounds. These sounds helps to identify the presence of fluid, air or solid masses inside the body. Different sounds are heard during percussion. Timpani is a drum-like sound usually heard over air-filled structures. Dullness is heard over solid organs or fluid-filled areas. Resonance is a normal hollow sound here over healthy lungs. Percussion helps to assess the condition of an internal organs. So next method is the general survey. A general survey is an overall assessment of the patient's appearance and behavior. During a general survey, nurses observe body build, hygiene, posture, mobility, facial expression, and emotional behavior. This survey helps to identify the signs of illness, discomfort, malnutrition, or emotional distress. A general survey provides important baseline information before detailed examination. So equipment used, different equipments are used during physical examination. A stethoscope is used for auscultation of heart, lungs and bowel sounds. BP apparatus, the blood pressure apparatus measures blood pressure. A thermometer measures body temperature. Otoscope and ophthalmoscope are used to examine the ears and the eyes. Tongue depressors helps to inspect the mouth and the throat, while tuning forks are used to assess hearing and vibration sense. So proper use of equipments improves examination accuracy. Then precautions. So certain precautions should be followed while during the physical examination. Nurses should monitor and ensure patients' privacy and explain the procedure before starting the examination. Proper hand hygiene should be maintained to prevent infection. Gloves should be used whenever necessary. Patients should be made comfortable throughout the procedure. Nurses should monitor and maintain a professional and respectful approach during examination to build patient trust and cooperation. So, in conclusion, physical examination is an essential part of nursing assessment. It helps to detect abnormalities, monitor patient condition, and support diagnosis and treatment planning. Nurses should perform physical examination systematically using inspection, palpation, percussion, and auscultation methods. Good observation skills, communication skills, and infection control practices are important for safe and effective examination. So, proper physical examination helps to provide quality, patient centered nursing care. Thank you.